Today we have Dr. Davis joining us to talk about food allergies in the Black community. Before we jump into this topic, Dr. Davis, welcome. We'd love to know just a little bit about you and your role as an allergist.
Thank you, Kortney. It's so nice to be here today. I am the director of the Texas Children's Hospital Food Allergy Program and the division chief of the Immunology Allergy in the Department of Pediatrics at Baylor College of Medicine. I became interested in food allergy when I was a young allergist because I had many patients who had many questions and concerns, and it impacted their quality of life. So as an allergist, my goal is to really help patients with food allergy have the best quality of life possible.
Amazing. And I think that quality of life is such a huge topic that we love on this podcast. So it's cool to hear that that's a focus for you. And I think we'll definitely be getting into that today.
I look forward to it.
One of the things that we really want to try to lay a context for is just the historical aspect of systemic and socioeconomic factors that really play a role still today in how patients are receiving their medical care and the disparities that exist in medical care for certain communities. So, Carla, could you go into some of those historical factors that contribute to all of these things now?
Sure. What health disparities are just a difference in health outcomes based on our economic, racial, ethnic difference. And many of the health disparity differences are caused by what we call social determinants of health. We've actually recognized now that social determinants of health play a very large factor in a person's health. And this is true for food allergies. So these social determinants of health include the places where we were born, live, play, learn, worship, basically, where a person exists in their communities. And there are 5 factors that influence or considered social determinants of health. And so these include education. They also include where a patient lives, our neighborhood and built environment. I mentioned the social community context, economic stability, and then finally, where you get your medical care, which interestingly is a bit of a minority of all of the other factors. And so historically, what we know is that policies and legislation influences the places where people are born and live and exist in society. 2 examples I'll share. The first one has to do with this policy that was put in place in the 1930s to 50s called redlining. If you've never heard of that, redlining was the homeowner's loan corporation description for different areas in American neighborhoods. It's kind of across the country. That's part of the New Deal. And so each of different areas where homes are located were assigned a security value. And by security, it meant kind of riskiness for banks to give loans to. So it restricted the sale of homes to residents who were African-American or from other countries, so immigrants, because the homeowners loan corporation said, okay, there is a risk and these people are kind of a threat to the stability of home values. And so what happened in these areas, there are greater environmental risks, and actually these are very directly linked for health outcomes and reduced life expectancy. And this impacts food allergy outcomes like asthma or wheezing and emergency room visits. That's one example of how a structural, historical policy can influence health outcomes and has influenced health outcomes. Another is insurance and the fact that if populations have lower income, then they're more likely to be on an insurance that is a public insurance, Medicaid or children's health insurance program. And many allergists or services are sometimes restricted for patients who actually have this kind of insurance. The reimbursement rate for doctors who give care to patients who have Medicaid is lower than patients who have private insurance. And so that is a structural thing that can limit access to care for patients with food allergies.
Yes. I mean, all of this stuff is so deeply rooted in things that have been going on for so long. And it's just important for all of us to remember that the reason that certain populations are having poorer health outcomes are because of these structural things that were put into place for way too long. And so today we're going to specifically focus on food allergy and the disparities that exist for patients in the Black community that have food allergies. So can you talk about what disparities you've seen?
Absolutely. So we know that Black, Asian, and Hispanic people have higher prevalence of food allergies, multiple food allergies. And in some specific areas, for instance, these populations have more seafood allergy, is what we found, as well as peanut and tree nut and soy allergic immune responses. We know that Black patients, they have a higher prevalence than white patients to really have peanut allergy and tree nut allergy. And additionally, there's a higher rate of emergency room visits when reactions occur in patients who don't have access to an allergist on a regular basis. These are some of the things that I've seen. Also, there was a study in an inner city that looked at the rate of food allergy action plans, which are educational materials that help patients understand when they need to give the epinephrine pin during the midst of a reaction. And Black patients were given those action plans less frequently than white patients. In a food-associated disease called eosinophilic esophagitis, we know that referrals to allergists for patients who have Medicaid or are in an ethnic minoritized group are less frequently given. So the patients who may come to an emergency room or primary care doctor have been shown in the past to get less resources, less information, and because of that, not have as much information about how to treat reactions. So all of these things are things that we really want to impact. The other thing I might mention is that patients who come from lower socioeconomic status conditions will have a somewhat harder time being either comfortable with getting an epinephrine injector, which is a life-saving medication for anaphylaxis, or they're fearful, even though it should be free and available to everyone through different means. There's some hesitancy.
As practitioners, oftentimes we don't feel that we have enough time to go into the weeds with our patients, but just asking, you said that you don't have your epinephrine device. Why is that? Having that open conversation and asking those questions is very important, because then we can find out that they're worried about something like that, and we can help myth bust basically and make sure that they aren't misinformed and that they have the correct information.
Absolutely. And another area I would say that we really need to myth bust or give more resources in the area of food insecurity, because 20% of patients with food allergies have food insecurity. And if one is from a minoritized community or a lower socioeconomic background, then the risk is higher in those patients. And so as providers, we actually need to have these open conversations about affording food that is allergen-free. There's a easy, simple question for food insecurity questionnaire that can be asked. Have you ever worried that you weren't going to have enough food in the past week, or even that you're going to run out of money for food the past week, the past month, the past year? And so those things can really help, because allergen-free food is sometimes up to 300% higher in cost compared to low allergen food. And dietitians are helpful in what a patient with milk or egg or wheat, soy, nut allergy can eat, and what's accessible and affordable.
Kortney and I had actually had the pleasure of talking to Emily Brown, who did a lot of work in this area. She started an organization that was specifically focused on making sure that homeless shelters and food banks were paying attention to the needs of food allergic patients, and that they were thinking about having food replacements. For example, milk allergy, making sure that you have some form of alternative milk in those places so that patients don't feel like they can't give their children an alternative form of milk. So I think that there are people thinking through these really difficult problems, and I'm really happy that these organizations and people like Emily exist, because these are the nuanced things, again, that you wouldn't really think about. But because of Emily, Kortney and I really learned a lot that episode and thought differently. Every time I see a food bank or request for canned food, or even during the holidays, I always think about food allergic patients and what they may be experiencing in these situations.
Yeah, it's really an important issue. And many times, if a patient or a patient's family isn't kind of adhering to what we have recommended, or they may have an accidental exposure, the follow-up questions I think should not be, well, you need to do better, but it would ask questions about, do you have any concerns about getting allergen-free food, and then asking, I think this gets into the cultural aspects. What kind of foods do you eat? And how is this particular food allergy impacting the food that you are able to eat? To really have an open dialogue and listen very well. Sometimes implicit biases, which we don't even know about, that we have in the healthcare system, can result in Black patients or other minoritized patients really receiving lower quality care. And so we see this in the food allergy space. And I, as a doctor, frequently try to check my bias for any particular patient. If I have assumptions before walking the room, then I say, no, Carla, at least I'm aware of them. And then I try to really see each individual patient as a new patient, kind of without assuming anything about them.
Yes. One thing that I always think is, okay, if I'm going to ask this question, what's going to be my follow-up, right? What resource can I offer? So if they do say that they have food insecurity and that they are not sure if they can afford the foods that they need to be getting, then what resources can I provide them? Because otherwise I just feel I've asked a question that I now have the answer to, but I have zero solutions to. And so one of the things that Kortney and I always try to do is have resources and links available for patients. We will do that today for this episode. What kind of recommendations do you give to people that are in that situation? And what can other physicians learn as an example from you?
So here at Texas Children's Hospital, we have social workers and dietitians, so we have a lot of resources here. But I frequently give people the findhelp.com, also known as Aunt Bertha, as a website where people can go and put their zip code in and then see what resources are available, what food banks. I love the Food Equality Initiative, or the Free From Market for the allergen-free food that's there. I think the Food Allergy Research Education is a really great resource for food allergic patients. I also think that the American Academy of Allergy Asthma Immunology and the American College of Allergy Asthma Immunology have great resources for patients that have food allergies. And then there are webinars out there called Black People Like Me webinar that's put together by the Allergy and Asthma Network. The Black People Like Me webinar actually has been proven to make a huge difference in participants. A really, really nice resource. I do think that Black people and other minoritized communities should go to their primary care doctor or provider and really ask for referrals, ask for more information, advocate, because it may not be something that just comes up on the provider's mind. And I recommend actually writing down questions before going to the doctor so that all of the questions can be answered. And I think that's a very nice way to really help break through the bias that may exist from a provider that's, again, unconscious.
Another topic that has come up on other podcasts when we're talking about food allergy is just navigating family and how that might differ for different groups of people. And have you seen that there is a harder time in navigating family for Black people?
There can be cultural factors, especially in food allergy, because different cultures have different foods that are eaten more frequently. So in the Black community, seafood and fish and that allergy can really impact family gatherings, because there may be crawfish boils in the South, where I am in Houston, Texas. There's just a lot of seafood everywhere, and little babies are eating crawfish and shrimp. So that's one example to pay attention to the specific foods that are more commonly eaten in certain cultures. So what I recommend, what I do, is when I have a list of food allergies and we're trying to figure out which one's real or not real, we really have to move with the family's preference for what is going to make the most significant impact to our quality of life, right? Of what we eat. And I think that that is something that is extremely important. I recommend patients really engage with the doctor when attacking food allergies, when treating them. We have so many treatments out now, trying to choose which foods are the ones that we want to either, be able to be around or be at the family event and feel more comfortable. So those are some of the questions that I think providers and patients really need to engage in and talk about.
I think with family, there's also this aspect of believing in food allergies. Like, do they actually exist? Especially when you don't see people that look like you out there showing that they have food allergies. I know there's a very specific type of person who's out there telling about their food allergy journey. And so I know a lot of communities just feel like food allergies don't exist because they don't see them represented in media. Do you feel like that's a big problem when you talk to your patients? Is there a way we can combat that?
Yes, I think that showing more patients of color and families who have food allergies and are successfully managing food allergies would really go a long way in ensuring that families of people of color accept the disease and understand that it is very important in their life. So absolutely, this is something that should be addressed. I also think generational differences exist, and it is likely due to the fact that currently the way that we live is not probably the way that our great-grandparents lived in terms of the connection or the interaction with the environment outside. And so allergies we know and even food allergies have increased over the past 2 decades. And so now that they're more common, it's important for parents, grandparents, great-grandparents to, in some cases, be engaged in the interactions with the medical community. This is why I think it's so important to have informational resources in patients' native language so that they can take that information and then at home share it with family members. I've seen that be very effective. The other area where it's important to ensure that disparities are addressed is in the school setting for children. In the school setting, I have seen Black and brown children have very difficult time with administration and teachers to really help them understand that the child needs to be safe and protected from exposure to certain allergens. And I think understanding that there are laws that dictate that for life-threatening food allergy, a school has to make accommodations for the child. I think that making sure that there's no stigma to getting these accommodations and having a 504 plan in the school setting is really important. And I encourage any families that are having trouble to engage their healthcare provider.
Thank you. Those are all really important recommendations. And for family too, having that family member that maybe doesn't understand or believe in allergies come to the visit if possible, so that the healthcare provider can really have that open conversation and help answer any question that family member might have. And even if they can't physically be there, you can virtually have that person be present. So really just having an open line of communication to allow for questions to be asked.
Can we talk? I just was curious because I know that this podcast is a little more heavily focused on the Black community. And so Allergy Asthma Network did this a really amazing patient survey. So they got together with a lot of patients and they kind of asked them, what's the pain point for you? I got to read the whole thing. It was very interesting. And one of the things that I came up with is just the journey of getting to that food allergy diagnosis. And I wanted to know, what are the struggles that you see commonly that someone maybe who is not sure if their child has food allergies or not, what are you going to say to them to push them to go to the GP and to push them to ask for a specialist?
I've seen many patients from Black and brown communities who are having symptoms of food allergy, and no one has recognized that these are symptoms of food allergy. For example, we know that anaphylaxis, the symptoms are skin swelling and hives, coughing, wheezing, and itching. Nasal congestion is rare without food exposure, can be a part of more constellation of symptoms, and then vomiting along with hives. All of these are concerning for food allergy reactions. And so I've had patients who have been diagnosed with asthma and have exacerbations when they are exposed to seafood or like peanut butter. When they're eating peanut butter, they're having these symptoms, and really no one is thinking about food allergy. They're only thinking about asthma, and or if there's vomiting associated or you have an illness. And so a pain point is really having that suspicion for food allergies. There was one young man that I saw whose family had a Friday crawfish boil every Friday, and he had wheezing every Friday and was on maximum asthma medications. And then we diagnosed the seafood allergy, took him out of there, and he was off of all medications, which means he was likely having anaphylaxis just every Friday. So I do think that because of the life-threatening nature and then the decrease in quality of life of these children who are on all of these medications is really the impetus that I would say to go ahead and ask your doctor to do that test. And the test should be specifically for the food that is suspected to have caused that reaction. Yeah, the one thing that I did not talk about was discrimination, specifically for Black patients. Historically, in the African American community, there have been studies that have taken advantage of the Black community and really done gross injustice to the Black community. During slavery, for instance, Black women were used for experiments, for obstetric experimental treatments or surgery without anesthesia. And the Tuskegee syphilis experiment basically infected patients with syphilis, and even when treatment was available, didn't treat them. And so it's widely known in the Black community that these kinds of experiments have gone on. So there is an inherent distrust in the Black community of experimental treatments and things done, in the medical community. There is a huge myth that when a Black patient is admitted to the hospital, they are going to die, because there's going to be a lack of attention to their needs. And there have been really quite public recent deaths. There was a death of the physician in a hospital, and she did a video beforehand and said that the doctors weren't listening to her. So all of these things are really fears in the Black community that need to be overcome. And I think on an individual basis, as providers need to reassure Black patients. I always help Black patients to know that studies and experiments now have to have their consent, and every single thing that's done during an experimental trial has to be by law divulged to the patient who's participating. And we need more Black patients in research trials so that the results actually reflect the entire community and not non-Black communities. So those are some specific things that I think are unique to the Black community that can be addressed through podcasts like these, and also individual providers really reassuring Black patients that they know about these injustices and want and understand that now things are different, but want to address any fears that the patient may have about their medical care.
Yes. I think that one of the really important points is that the fear for research is really real in the Black community. And because of that, it's hard. I don't do research personally, but I've heard from my colleagues who do research that it's really hard to recruit Black patients into trials because of the mistrust of the system. So the reason that it's so important in research is because we want to make sure that the recommendations that we're making are relevant to Black patients. And we do know that there are differences in the way that treatment should be provided for different communities and different people, so that we can come up with the best protocols to treat Black patients?
Absolutely. I think that we really need to make sure that Black patients are included because we want the results to be generalizable and make sure that, and so I do clinical trials. I, as the director of the Immunology program, we have, at least 10 clinical trials ongoing. And it really is important for us to understand if new treatments are really effective in Black patients as well as all the other patients. So I really do encourage Black patients to engage. I do know that when there's a diversity of clinical staff that are working in these trials, it can be very helpful because we know that health outcomes tend to be a bit better when there's provider patient concordance, not just in the Black community, but in many communities, but definitely in the Black communities. So that's just something to think about as care is given and as clinical trials forward. But I do think that it's important for the new treatments and to be widely disseminated and information about those new treatments to be widely disseminated, including to the Black community. The new treatments for food allergy are oral immunotherapy and then a shot for treatment. And I think it's important that patients in the Black community and providers of those patients have a shared decision-making conversation about these treatments. In some cases, there may be a thought that if a patient is of a lower socioeconomic background, they may not be able to or want to engage in some treatments, but we know that that is not true. So for all patients, these new treatments should be addressed and discussed. In clinical trials or when giving medications or when thinking about things, we always need to look from a lens of affordability for the Black community. It's not for everybody, but really thinking about the fact that there are systemic factors that have contributed to this population not having as much wealth that continue today. And then how can the treatments that we're giving be really generalizable and affordable for the family and the patients that are sitting in front of me?
Thank you. I just also wanted to mention the food desert, that concept, these food deserts, thinking about redlining. So those particular areas were not invested in, continue to not be invested in. And so you don't have those larger supermarkets. And that means oftentimes people are made to shop in smaller bodegas and smaller, or we call them bodegas here in the city, but smaller shops that don't always have the diversity of food available. You're not going to find alternative milks in a smaller shop that can only carry limited stock. And so those are all things that, especially for a food allergic patient, are so important. And so that's why patients in Black communities have a harder time finding the foods that they can give to their family.
Absolutely. This is a really important point. Hospitals were not placed in the areas that were redlined, and then fresh fruits and vegetables not available in areas that were redlined. And so this divestment of businesses and opportunity, even schools, right? Great schools really impacts the food allergic patients. And we know that actually in development, if you don't have environmental exposure to diversity of a diet, you have stress associated with lack of green space, lack of educational opportunities, lack of healthcare access. All of those things can actually, from a immunologic mechanism standpoint, actually drive people towards having more allergies. So all of this is connected. And I think the more that we know about this, the more we can begin to combat it.
I think that's a really nice way to end it. But can I ask one more question? You mentioned patients don't feel like they're being heard or they're not taken seriously, and that leads to potentially not getting a proper diagnosis. From the patient perspective, what can I do to make sure that I am being taken seriously? And what can patients do to actually get that diagnosis if they feel like they're constantly just being put against the wall?
Yes, I think there are a few things that I'd recommend for Black patients to do when they come to an emergency room or their own provider, I recommend that they really look the provider in the eye and be very engaged in the conversation. So not necessarily on their phone, and then even think beforehand or at the time through specific questions that they want to know. I recommend that when information is given that they don't completely understand, that they say, "I'm sorry, I don't understand that. Can you please explain that in a way that I may be able to understand?" So that they can ask clarifying questions. And then I think that follow up, if they don't feel comfortable with the interaction, that they reach out to someone, whether it's their primary care provider or nurse or family member that can help them in that situation. I think that would be also very helpful. And my relatives and other people that I know, sometimes reach out to me if they don't feel comfortable. So all those are things that they can do in order to help the interaction. But if the interaction with the provider really doesn't ever get to feel comfortable, then it's fine to look for another provider or change to another provider. So that's what I would recommend. It's really important, and I'm so glad you're doing this podcast in order to talk about food allergies in the Black community. And I hope that this will empower providers of Black patients and Black patients to feel more comfortable with their food allergies and in their interactions with their doctors. Ultimately, we want to improve the quality of life.
Exactly. Yeah. Thank you so much. And I know that Allergy Asthma Network is actually creating a video series of Black patients with food allergies just because they want to make sure that they're being represented in media. And I know that that's going to come out soon. It's coming out June 2024. So there is stuff that's going on right now that's going to hopefully give more faces to this community.
Yes, that's great. That's fantastic. And I'm hoping that it'll bring people together and improve health outcomes.